Well, yeehaw, and welcome back to MMHC. Eddie Correa, what is our topic for today?
I can't like describe it, but there's like a specific like SpongeBob episode that comes up with like some similar like character voices on there. And that's like the first thing I've thought about. So I actually am not, I forgot what our topic is today. Do we have a topic? No, just kidding. The topic, therapy, the basics of therapy, therapy 101. Psych 150, or maybe it's more of a graduate level. So Psych 510 would be like the course number. We're just going to talk about therapy, what to look for in a therapist. What are the modalities specifically that some therapists do? What do they mean? What do the acronyms mean? Just want to give you information so that you can be the best consumer of therapy as possible. I think there's a ton of acronyms in probably a lot of medical professions, but in mental health for sure. I mean, my licensure is an acronym. Other licensures are an acronym. Different therapy modalities are acronyms. The acronyms are everywhere. So hopefully with us talking about specific modalities today, we can clear that up. We can make it a little easier. So if you are looking for a therapist, if you're helping someone find a therapist, you at least know what you're looking at. You know what these different acronyms mean, and it makes it a little easier. In a lot of the episodes that we do, Justin will add a section on like treatment options, like what is helpful for an eating disorder, what is helpful for ADHD, autism. And oftentimes he will put specific therapeutic modalities. And we thought about it and we're like, well, we mentioned these things, but we're not really sure if we've really ever talked about what those things are specifically. What is DBT? What is cognitive behavioral therapy? We also want to mention that 4 years ago, long time ago, one of our very early episodes I think it was a single digit episode, Justin. I don't know if you remember. I can barely remember, but it was basically like how to find a therapist. So we did that, but we really didn't talk extra about the modalities. So that's what we want to talk about today. We want to talk about some common modalities, some things to look out for, some thoughts that we just have professionally, just the importance of being a good consumer if you are someone that's going to look for therapeutic services either now, in the future, you're trying to help somebody. So that's the biggest thing for us. We want to make it easy for y'all to understand. Before we keep going, before I keep rambling, Justin, do you have any shout outs, anything you want to cover before I just jump even more into it?
Yeah. I want to shout out you, because on the How to Find a Therapist episode, you told me and our listeners about psychologytoday.com, which is a great way to find a therapist. It's not the perfect way, but it's something I use all the time because I have lots of patients come up and say like, hey, I've got TRICARE. I need someone who does autism testing, and I need it for ages like 6 to 11. And I'm like, okay, I can plug all that into psychologytoday.com, and it actually gives me a list of people. And so it's been a super helpful tool for me too, especially with starting my job as an attending and not knowing the resources as well in Wyoming. So yeah, psychologytoday.com is a great way to start that process for finding a therapist. How about you, Eddie? Any shout outs for us?
Well, I'm glad it's been helpful, first off.
Yeah.
In terms of shout outs, I mean, this is cheesy, but just our listeners, our supporters. We're wrapping up another calendar year. We're going into the new year. We're thinking about taking a little break right after this episode, but really just thankful for all you who continue to listen and give us reasons to talk, to record, to give you stuff to listen to. So thank you guys again. Justin, I'm glad Psychology Today has been helpful for you. One thing I'll add, I've noticed in the years now that I've been using it, more recently, they've added this, not really a feature, more of a reminder or just a suggestion that if you do use Psychology Today, immediately after you email someone on the platform, like a therapist, it'll say like, oh, let's try to find you 2 to 3 more so you have options. And I think that's to basically acknowledge that it can be kind of hard to find a therapist. Again, the Psychology Today is not perfect, but it is really helpful. And I actually just used it today to try to help a student who needs help. So with all that being said, going to ramble a little more. Let's just start with a little definition. So according to the National Institute of Mental Health, psychotherapy, the term, refers to a variety of treatments that aim to help a person identify and change troubling emotions, thoughts, and behaviors. That's I guess in a nutshell what therapy is. Many types of professionals can conduct psychotherapy. So that includes psychiatrists like Dr. Justin, counselors like your boy, psychologists and social workers. One thing that it didn't mention in there, but it falls under kind of like the same master's level clinicians, is also like marriage and family therapists. If you're not in the field, you don't really pay attention too much to it. But one thing to just be thinking about if you're ever going to look for somebody is just that different states have different titles for therapists. So like for me, I'm a licensed professional counselor in the state of Oregon. I believe the similar licensure to myself in California is a LPCC, which is a licensed professional clinical counselor. Right above me in the state of Washington, literally an hour away, if you cross the river past Portland into Vancouver, Washington, they go by a similar licensure as LMHC, so licensed mental health counselor. So just things to think about. At the end of the day, as long as either someone's licensed or at least registered with the board, that's probably a good thing in terms of finding a professional. Oftentimes people who conduct therapy are licensed professionals, but in the case of master's level clinicians like me back in the day, professional counselors, marriage and family therapists, mental health counselors, and social workers, there is about a 2 to 4 year period where they're working towards licensure. So you're not just automatically licensed once you graduate and complete your national board exam. It takes a couple years of basically getting on the job experience that you can do like on your job. Like you have a full-time job, you're getting paid for it. What you're doing is you're accruing hours. And then once you have enough, once you meet the state's requirements, you can apply for licensure. You can have the fancy license. You can have the nice little piece of paper in your office that says, I am duly, like I was going to use a word, but it's going to be the wrong one. Because if I say I'm duly licensed, that means I'm licensed twice. That's not what I mean, but I am licensed by the state of so-and-so. I have met the requirements. I am legit. I do my continuing education. I do my whatever it is. So that's a little bit on that of therapists and like the basic bare bones information before we really jump into it.
Yeah, and we bring up that last point because oftentimes when you're searching for a therapist, you may see people who include the word associate in their title, and this means that they're registered with their state board and are working towards that license.
Mm-hmm. Yeah, and like I mentioned today, there's a number of different approaches, but for today, we're going to focus on, I think, the main three, people will call it the third wave of behavioral therapy, or just kind of the third wave, the newer wave. There are some newer modalities that I'll mention at the end, but this is kind of like the one that a lot of people will mention. So very first one, cognitive behavioral therapy, CBT. Like this is the one. This is like the one that everybody will say they know because most likely they do. This is the main one that's talked about in school. This is like Modalities 101. Like this is the first thing you're writing on your notebook or you're typing into your computer or whatever is CBT. It's probably the most intuitive. It really just makes sense. Really, the basic premise of it is trying to find, discuss, and make changes to the connection that we have with our thoughts, feelings, and behavior. So think of it as a triangle. You have this imaginary triangle in front of you. I'm picturing it. I hope you're picturing it too. On one corner, you have thoughts. On the other ones, you have feelings. And on the last corner, you have behaviors.
Yes. And in CBT, this is where you see a number of therapists utilizing worksheets. So oftentimes we have a lot of homework and assignments. So say you're in therapy for a type of anxiety. Say you have some social anxiety. Some of that homework might be, okay, what's one step you want to work in the direction of being in public, forcing yourself to work on these things, to expose yourself to the things that make you anxious with the hope of them not making you more anxious in the future. So the goal of CBT is to take the understanding of how those three pillars that Eddie mentioned are intertwined and then learn how to best manage stressors so that now you can react or your reaction of behaviors, emotions, and thoughts will impact the other.
Yeah, like you're just more aware. Like you know that if I have these certain thoughts, this can impact my emotions. And this way, if my emotions are this way, this is what could happen to my behaviors. some common disorders that are treated with CBT. If you ask, like, if you ask insurance, everything is treated by CBT, but insurance, we don't really care what insurance says sometimes. But really, the most common ones that are studied a lot: depression, anxiety, phobias, PTSD, and substance use disorders. There's more, but I think those are the ones that come up often, that are just like CBT, bam, it's like the one size fits all, even if it doesn't necessarily always fit all.
Yeah.
With like all types of things that we tell you about, we at least want to give you both sides of it, the pros and cons. So I'll start with the pros. CBT is something that's highly studied and backed up. If you go to Google Scholar, which is a great free resource to try to find articles and just things to read if you want to learn more, CBT has a lot of articles that kind of will replicate studies and be able to have some pretty strong evidence for it. A lot of studies show it to be highly effective in the disorders that it can treat. It's versatile. It can be used in different settings like groups. I teach about group therapy every summer to master's level students. I enjoy group therapy, so CBT is definitely something that can be used. Another really good pro is that it can be used as a short-term intervention. So it's something that, like, some people, if you say you work somewhere where you have this benefit of 8 free sessions of therapy, oftentimes you're going to get someone that practices CBT. Hopefully in those 8 sessions, they do a good enough job to help, like, in the interim and help you learn and be able to really take some good information home, so it's able to make a positive impact on your life. But oftentimes it could be used as a short-term intervention, and early evidence shows that it can be effective for internet and social media addiction, which Justin has a great TED Talk on.
So yes, go check out that TED Talk. I was doing some research recently, and there's not a lot about social media and internet addiction because it is such a new addiction, but there is some good evidence showing that yes, this can be applied to internet, cell phone, smartphone, social media addiction. So that's a major plus. Some of the cons of CBT is that it can be difficult if your readiness for change is not there and it's not able to shift towards action. So you have to be ready for therapy. You have to, like, if you're forced to do it, if you're court ordered to do it, if your parents are forcing you to do it, it won't be quite as effective. And that might be true for most therapies too.
Yeah.
There is a lot of homework and worksheets. So if you're the kind of person who says, like, hey, that's not my jam, might not be the right therapy for you. And sometimes because it is the tried and true, it is the one that tries to appeal to everyone. Sometimes it doesn't appeal to everyone. And sometimes it can be too rigid for some clients that need a little bit more flexibility and can't stick to the exact program.
When you said tried and true, it just made me think of, like, a bald eagle, like, flying across the screen and just like, yeah, if you need a truck that can handle whatever life throws at it, pick Ford Tough. I don't know why. That just
So CBT is the Ford F-150 of the therapy world.
That's pretty good. It's the tried and true.
Tried and true.
Real quick though. Okay, so now that you say that, I have to throw this in here. Okay, it's super off topic. Holy shit. Okay, back in 5th grade, it was part of, like, the California standards that you had to learn about, like, U.S. history. And obviously, like, not all the facts of U.S. history, but just, like, the basic, like, oh, the British and Paul Revere and blah, blah, blah. So at the end of the year, the 5th graders did this big performance where they would do, like, a skit or a play that took you through the years of America, basically. And we had to sing in it. One of the songs we had to sing was "And I'm proud to be an American." So that made me think of that. But back from the tangent, before we continue, one thing I wanted to mention, I told myself, say this before you even talk about CBT, but of course I messed it up, but that's okay. One thing that I do want to mention, yes, modality, expertise in modality, being like a fucking expert in DBT, whatever. Modality is great. It can be really helpful. It can be really impactful, and it can really make or break, if you're able to get better or not. I personally think, and professionally think, the thing that is more important than specific modality is being able to connect with the therapist and being able to make a connection with a random human that you are meeting for the first time, that you are reaching out to for support at potentially your lowest, and going from there.
Mm-hmm.
I have told my students this. The very last day of class this last summer semester, someone had mentioned that one of their professors had said, like, that they said you have to like pick a modality and stick to it, and like you can't say that you're eclectic and you do multiple things, blah, blah, blah. And I said, fuck that. Do whatever you want. Do whatever you're comfortable with ethically. Make sure you know what you're doing and you're read up on it and you're competent in it. But really, the most important thing is being able to connect with somebody. Like, I tell students this all the time. You could fucking buy whatever manual you want. You could take whatever training. But if you can't meet someone for the first time and make a connection with them within 3 minutes, 2 minutes, that makes them say, like, yeah, I can work with this person, or I can tell them some of my most difficult thoughts and feelings, then the modality is out the window. It doesn't matter what the hell you do. So just something that I think is really important that we share.
Yeah, and that's actually a great point. And that's actually backed up with studies and evidence, is that ability to connect, that connection you have with your therapist changes the outcome more than anything else. So yes, modality is important, and it's important to do the right type of modality in the right situations, but that connection is pinnacle.
Yeah, absolutely. What do we got next?
Up next, we have dialectical behavioral therapy, which is one of my favorite types of therapy. This was created by the OG, Miss Marsha Linehan, to help with borderline personality disorder and suicidality. We do have episodes on borderline personality disorder if you are, and suicide, I believe, actually, if you are so interested. So this is a highly structured and manualized approach. According to Le Cleveland Clinic, the term dialectical refers to working with opposing forces. So di meaning two, electical apparently meaning forces. So the aim is to accept yourself as you are, and at the same time, embrace the power that you have to change. So one of my favorite lines in this is, I'm perfect just the way I am, but I still have room for improvement. Like, it's important to give yourself that grace and say, like, I'm okay with who I am, but there's always something I could be working on. So DBT has 4 pillars: mindfulness, distress management, emotional regulation, and interpersonal effectiveness.
DBT is some good shit. Yeah. I have been on this like kick of just being so intrigued by it since the summer. My students were doing their final projects, and 1 week is about DBT and group therapy. And there was something about one of the presentations where I was like, man, I've known about DBT since I've been in school, but maybe it took me until I was 30 years old in the summer and been in the field long enough to be like, wow, this really clicks for me. This is so cool. And I think I told you about this. I probably mentioned it in one of our episodes around the same time. But that same night, I checked out Marsha Linehan's book, Building a Life Worth Living. It's her memoir. And I read that thing in like a week because it was just so good. And it talked about like her journey of struggling so hard. And I didn't put this in the note, and I know Justin knows this, but yeah, it was made she created it to help with borderline personality disorder and suicidality, but she made it to help in those things with her, because those are things that she was struggling with and she was having a hard time with. And she was in and out of like long-term treatment, not any of that like outpatient once a week stuff. Like, she was in residential. Like, so she had it tough and she worked through a lot. And it's really cool too, because a lot of the components of it come from they're not Western cultures, like more of an Eastern culture. I think she even stayed with like Buddhist monks for a while. Like it's really cool stuff. And it inspired me to take a DBT and a nutshell training maybe like a month later. I'll be the first to say I will never do the Marsha Linehan DBT certified thing. That's just not an interest to me. But being informed by DBT and knowing like some basic skills and stuff, that's stuff that I think is really cool and really resonate with. And one thing that I've actually, because of the book and the training this summer, one thing that I've actually really focused on with my kids who are in crisis with either like anxiety, a panic attack, or just feeling like they're just so overwhelmed, is doing one of the techniques of kind of temperature control, and either giving them a cup of ice or getting them to like splash their face with water to try and bring their overall body temperature down, which then brings down their heart rate, helps them calm down. So DBT is some good stuff. We'll talk about like what's kind of hard about it, but it's really good. So I hope you can hear from my like my tangent that like it's just been so like interesting for me, like this little like DBT intrigue journey that I've had the last 6 months.
Totally. And yeah, it sounds like Eddie and I are both big fans of DBT because those 4 pillars that we mentioned can apply to everyone. So mindfulness, being aware of your thoughts, feelings, and emotions and how that impacts your life. Distress management, how to be able to calm yourself down if you're really worked up. Emotional regulation, how to make sure your emotions don't get in the way of your life. And interpersonal effectiveness, communication, conflict resolution, all of this stuff everyone could benefit from. And that's one of the reasons why DBT is such an impactful therapy. And there is a large importance on using coping skills to deal with these stressors. So it teaches you specific skills, gives you a ton of suggestions of how to actually use this stuff to make your life better. And DBT itself can be used to treat things like borderline personality disorder, which 4% of the population has, substance use disorders, eating disorders, and suicidality. So it's a little bit of the opposite coin of CBT. It's a little bit more specific for specific disorders, but man, in those things, it can be super effective and really change people's lives.
Yeah, I think one of the cool things about DBT, and I think what really makes it stick out compared to the other 2 that we're talking about tonight, is the other 2 give you like almost like some thoughts. So you have like, they give you mental tools, like you have a mental toolbox to use, whereas DBT almost feels like you get more of like physical tools with the coping skills that it teaches you. So it almost feels like you're like actually leaving with something, like even though it's not physical, but you're leaving with something, whereas the other 2 you're almost kind of just not just, but you're trying to restructure the way you're thinking about things. So I think that's another cool thing about it.
Yeah, it's a little more tangible.
In terms of pros and cons, I told you we're going to talk about both today. Pros, so it's evidence-based, very evidence-based. When done to fidelity, so when done to the way it's supposed to, when it's reaching all the requirements that have been set forth by the National Institute of Marsha Linehan, or whatever it's called for DBT, the client has access to the clinician outside of therapy sessions. So that could be really helpful. There is a texting component with like legit DBT certified clinicians where they know that they might be on call with certain clients. And it's highly effective in groups. It's another really great one. You can teach a group of people some coping skills, and now you just have a group of people that left your group room that all just learned a skill that'll help them in the near future in their life.
And the idea of being able to connect with your provider even outside of sessions kind of scares the crap out of me. Like, I know I couldn't do that because I need to separate from work when I'm done. But for those people, one thing I noticed, the people who need DBT the most, the people with borderline personality disorder, oftentimes are the types of people who don't feel like they have someone to reach out to in a big suicidal episode, anger episode. So it's really useful for them to have someone, or the people in their life are very invalidating if they have one of these episodes too. So being able to access a therapist in a crisis can be very useful for them and help prevent a lot of negative outcomes. Some of the cons of DBT is that it can be hard to find someone who is certified. That's the biggest con for me, is just getting people to a DBT therapist and making sure they have openings and taking new clients. It can be hard because I want to give everyone DBT, but it is a limited resource. It is also a significant time commitment. I usually tell my patients, like, we're going to start this therapy and it is going to help, but it will take months, 2 years to really see the full effects of it. So I want you to stick with it as much as possible. And it is very structured and usually has a lot of homework. So again, if you're not a homework person, this might not be for you.
Yeah. And our last of the main three that we want to talk about, and I think this one is the newer or newest of the three, is acceptance and commitment therapy, or ACT. ACT aims to develop and expand psychological flexibility. So psychological flexibility encompasses emotional openness and the ability to adapt your thoughts and behaviors to better align with your values and goals. And I want to share like a way to think of the three when we're done with this one. So if I forget, just to remind me, but I have a thing that I've thought about and I think it works. Similar to DBT, with ACT, you're paying attention to the present moment. But instead of turning to a specific coping skill, you turn to your own cognitive flexibility and work through accepting the present moment. ACT also has its own pillars, but they call them the 6 core processes, which include staying present, diffusion, committed action, personal values, self as context, and acceptance, all of which are centered around the idea of psychological flexibility.
And I remember I had an attending once that explained it to me a little bit, and correct me if I'm wrong, because acceptance and commitment therapy is probably the one I'm the weakest on. But he said it's like you have to accept the things in the world that suck. And get to a point where you can accept it and then move on and focus on the things that you actually enjoy, focus on the things that you can control, which is a really healthy thing, because especially in our world of social media, 24-hour news cycles, we are constantly faced with bad news and bad stuff that we have no control over. And I see how it affects a lot of people and they let it get them so down. So it seems like ACT might be something that is really important for this next generation, because they are just bombarded with bad news 24/7. Yeah. And you're correct in did I ever tell you about the book, The Subtle Art of Not Giving a Fuck? Yeah. The guy is not a clinician at all that wrote it, or the person that wrote it, but a lot of the principles in there are kind of ACT based, where it's basically like both things can be true. This fucking sucks, and this is what I can do to not let it impact me. Yeah, exactly. Yep. So ACT can be helpful in treating anxiety, depression, substance use disorders, and chronic pain, which is fascinating. A lot of therapies can help with chronic pain issues too. And it's oftentimes an overlooked aspect of mental health that can be really useful. Some of the pros of ACT are that it promotes psychological flexibility and mindfulness. It is evidence-based. A lot of studies have shown that it is useful and effective, and it takes a holistic approach, which I know a lot of people are looking for. They want that holistic approach. Yeah. Some cons: it requires active participation, which I think we could honestly put for any type of modality. You gotta participate. I mean, there's no other way around it. We can't really fix it for you without that. There's a limited emphasis on the past. Some people don't like that. Some people feel like if you're not going to focus on the past, then you're really just like bearing it down. But it depends on who you ask. There's a lack of standardized protocols, which for someone like me, hell yeah, that's pretty cool. But for some people, they don't like that. And then the last part is it's not a quick fix. So trying to teach yourself this ability to be like, wow, that really sucks, and I need to move forward from it so that the rest does not suck. And when we've talked about where with like therapy, it can be that thing that helps you build new pathways in your brain, where when something negative happens, you're able to like choose a different way to react. Similarly, it's like it can take a while to do that. Everything takes practice, right? So it's just something to think about. I did add to I'm going to go on a little more of a rant, but I promise it's important. Well, actually, before, let me share what the thought I had. Okay, CBT, DBT, ACT, right? The three of them have a sort of basis in the act of maybe not mindfulness per se, but being present and being able to acknowledge the present moment. CBT is all about being present and being able to see how the present moment has impacted the 3 pillars, right? Emotions, thoughts, behaviors. DBT is all about
being present in the moment and being able to decide, this is the coping skill I'm going to use right now to help deal with these stressors. ACT is all about being present in the moment and saying, fuck it, I'm going to go ahead and move forward and not let this hold me back. It's a very, very simplified way of thinking about it, but that's how I explain it to students, and that's what helps me remember like how they're all a little different from each other.
I like it.
Bam.
Boom.
Okay, so now the rant. Okay, some modalities to be aware of. EMDR, eye movement desensitization,
reprocessing.
Reprocessing. I was going to say reciprocity, not reciprocity. That's one that's very popular with trauma, PTSD. There's a whole component about it with like moving your eyes and tapping noises and stuff. Can be really helpful. I've heard good things about it. That's one to know. Another one is trauma-focused CBT. There's like a specific branch of CBT that's all about focusing on trauma. I literally just stated, like I said, trauma-focused CBT, and then I basically said it backwards saying, yeah, trauma-focused CBT. It's CBT that's focused on trauma. That's terrible. It's just a specific branch that is the main component to it. And then the last two, these are the interesting ones, and I don't know if you're familiar with these, Justin. Internal family systems, or IFS, and then polyvagal theory. I tried to read into both of these to give them a simplified thing or simplified like description, but it was a little hard to do so. So really what I want to say with both of these is this. These are ones, the last two, internal family systems and polyvagal theory, that have really blown up in popularity recently. If you go on the subreddit therapists, there's a lot of posts about it. A lot of people are interested in it. A lot of people want to be trained in it, specifically IFS. A lot of people have questions about it. And I bring them up because both of them have mixed reviews. And I just think it's important that you are a knowledgeable consumer. That's kind of the point of today's episode. In the simplest of terms, IFS first. It takes a look at the whole person, and it basically says they are made up of different parts. A lot of therapists have found this approach to be helpful with their clients and in their own work, basically helping them compartmentalize like who they are as a person, and somehow for some people that just helps them, I think, feel more in control and have a better understanding of them and how they react with the world. As a clinician, one of the biggest criticisms that I've heard about IFS is the cost of becoming certified and how difficult it is to find certification programs. So for them, some people have complained that it feels a little gatekeepy and it feels a little hard to access. And because of that, is it really something that's helpful if you're going to make the access point to it so difficult? Something to think about. As far as polyvagal theory, there are some concerns that it is an oversimplified approach of how it describes our nervous system. So that's the most I could get as far as giving you a simple description. And one final thought about it. I was talking to a colleague and asking if they could spread the word on our Oregon Counseling Association conference that we had in October, a couple months ago. And when I told her about it, they asked if there was going to be any presentations that were not evidence-based, such as internal family systems and polyvagal theory. So take that information however you want it. That's what some people in the field think about it. At the end of the day, really what's important is that you find what works for you, you find what fits your budget, and you find a clinician that can meet your needs and that you feel comfortable working with.
Yeah, and I know we talked a little bit about those types of trauma therapy, and the two most popular ones right now are EMDR and trauma-focused CBT. And I think that's really important. Like, if you do have a diagnosis of PTSD, if you have been through traumatic events, and you're just doing regular CBT, you're not really digging in and processing the traumas that you have went through. So I always try and recommend, and I see patients who come in, and they're like, oh yeah, I've been doing CBT for years. I don't feel like it's really helping that much. And I dig in a little bit deeper, find they have PTSD, and I say, okay, I know you love your therapist. You've been with them for so long, but I think you need something more. I think you need to work on this trauma. I think you need to overcome that trauma. So that's preemptively saying, like, if there's one take-home point from me for today, is that if you do have trauma, try and get into a specific trauma therapist. That is the best way to overcome that trauma. And again, it takes months to years. It is a process. And sometimes trauma therapy makes you a little bit worse before things get better, because you're having to dig up these difficult memories. You're having to relive your traumatic experiences. It sucks. But if you want to get better, it is so important. And that's the best way we know how.
Yeah. I love it. Well said.
So Eddie, how important is it to be in the right type of therapy?
Yeah. We've talked about it a little bit. I think the right therapy is important. I'm not going to say very or not that important. It is important. I think the most important thing is finding the right therapist, the one that you can connect with, the one that you're able to go to certain places with in terms of like difficult areas of your mind and of your being. So I think that's really important. What do you think?
I would say it kind of depends on the diagnosis sometimes.
Yeah,
like
that's a good point.
If you're dealing with bread and butter psych and mental health stuff, depression, anxiety, the connection is the most important thing. But if you have borderline personality disorder, you should be in DBT. If you have trauma, you should be in trauma therapy. That is the best way to address the elephant in the room, to work on the things that's going to make you better the most.
Yeah. What about changing therapists? Is that allowed?
Yes. This is a question I get all the time from patients.
Yeah.
And usually my answer is the relationship fixable or repairable with the therapist? Like, what happened? Why are you upset with therapist? Why do you want to change? Can you talk to therapists? Because your relationship with your therapist is like a free trial. You can try different things with them. That's what they are there for. You should be a little bit. You should advocate for yourself. You should tell them when things aren't going well. Tell them when things bother you or you don't like a certain part of the therapy. So I'd say if there's something about your therapist you don't like, try and fix it with them. Because that in and of itself, learning how to fix relationships instead of just bombing them and moving on to the next relationship is a really important life skill that you can translate to your friends and family. I know a lot of people who do that. When things start going south in a relationship, they bomb it and get the hell out instead of fixing it and moving forward. So I think using that with your therapist is a really important thing and something I always advocate my patients do.
Yeah, I like it. I think I try to remind myself that I'm not everybody's cup of tea as much as I want to be as helpful as possible, and that's totally fine. I see on the subreddit a lot, the therapist one, that newer clinicians will be like, am I doing something wrong? Like, this happens to me. People keep leaving, whatever it is. And it's just important to remember it's not necessarily about us. It's about being a potential component to someone's getting better. And it's their right to choose who is going to be part of that process.
Yeah. And then I'm curious, what do you think about what's a sign that you maybe need to change therapists or you're not doing good, solid therapy?
Yeah. Yeah, I think if the therapist is just talking about themselves the whole time, I've heard of horror stories like that.
Yeah.
If the therapist is not using your input, like Justin said, like if you're a client that's trying to make things better and the therapist is just not taking your input at all, that's an issue. Logistical things like shitty communication, showing up late, even especially if it's virtual. If you have a therapist that can't even get on time to a virtual appointment, that's a big problem.
Yeah.
Yeah, I think those would be my main ones.
Yeah. I would say the only thing I would add to is, I've had some people who they've got like a significant trauma therapy or bad relationships with their parents, and they've been like with a therapist for a year, and I'll ask them like, hey, have you ever talked about this with your therapist? And they'll be like, no. Like, you've been in therapy for a year and you never talked about your relationship with your parents or your trauma? Like, okay, what are you doing? They're like, oh, he just asked me about my day. And I just kind of tell him and then I leave. It's like, that is not therapy. You shouldn't just go in and vent or tell them about your day. You need to be working on stuff. You need to be digging into this stuff. So if it's really superficial and you're just passing the time for an hour and then getting out of there, that's not therapy.
Facts.
Yeah.
Yeah.
We got some celebrities that have been big proponents of therapy. Number one is one of my favorite artists from my college years, Kesha. And I didn't put the $sign instead of the S in the show notes.
So you wrote it wrong.
I misspelled it. But Kesha had a really good quote that says, "I feel like part of my job was to be as skinny as possible. And to make that happen, I had been abusing my body. I just wasn't giving it the energy it needed to keep me healthy and strong. My brain told me to just suck it up and press on, but my heart knew that something had to change. So I made a decision to practice what I preach. I put my career on hold and sought treatment. I had to learn to treat my body with respect." I think that is a very good message for young women in this country.
Yeah. You know what song was my shit back in the day? It was Your Love Is My Drug.
Yeah, that's a great song.
Yeah, that's a banger. Still, to this day, that's a good-ass song.
Oh, yeah. She had some real bangers back in the early 2010s.
Her, Katy Perry, like, some of these people were fucking running our mixtape CDs that we would make.
Oh, yeah.
Next up is Kerry Washington. She's an actress. She's got a good quote. Saying, and I quote, "Learning how to love myself and my body is a lifelong process, but I definitely don't struggle the way that I used to. Therapy helped me realize that maybe it's okay for me to communicate my feelings. Instead of literally stuffing them down with food, maybe it's okay for me to express myself."
That's pretty cool. In that article, she was talking about how she used to struggle with binge eating. And so that's kind of what she was doing. She was trying to stuff herself or stuff her emotions down with food, which a lot of people do.
Yeah.
And then the last celeb we have on the list is Charlemagne the God. He's a big proponent of therapy, especially for the African-American community, and especially men in the African-American community. But he also talked about how if you're still experiencing trauma, if you're still in the hood, if you're still in the ghetto and constantly being traumatized every day about how rough that environment is, it can seem like a ridiculous thing to go to therapy, but it still helps you. It's still an important thing. So I really liked that quote. And he just recently guest hosted The Daily Show and did such a good job. He was hilarious.
Oh, yeah. I used to randomly, when I would drive to work really early and I had like a long commute, and I listened to the radio, I'd switch between two, and his show was, is it Syndicast? Is that the right word?
I know he was on The Breakfast Club too.
Yep. Yeah. It was The Breakfast Club, and it would play on the local station, but it was like his live show. I think they were doing on like the East Coast. So I used to listen to him a lot actually in the morning.
He's pretty good. Yeah. Thoughtful guy.
Yeah. Well, with that, thank you all for making it this far. I think we're going to lean into letting this be our last one for the calendar year. We appreciate you all. We hope you have a wonderful holiday, great new year. We'll see you early January 2024. Let me run through our final things that we finish every episode with. That being, you can find us everywhere. Apple Podcasts, Spotify, whatever podcast app you use. YouTube Music. Now you can see our show on there, which is pretty cool. I think YouTube Music's a new thing. Maybe it's not, but I heard about it for the first time recently, so that's why I'm mentioning it. But we're on there. If you use Apple Podcasts, feel free to leave us a 5-star review. You can leave us a comment too. And on Spotify, you can leave us an answer to the question, what did you think about the episode, as well as a 5-star review. On social media, at MillennialMHC. Thank you. Happy end of 2023. Hoping for an even better 2024. And as always, take care of y'all mentals.
Cuida tu salud mental.
Let's go.
That just came to me. I figured I may as well.
I love it.